Alzheimer's disease is the sixth leading cause of death in the United States and the only cause of death among the top 10 in the United States that cannot be prevented, cured, or even slowed. Dr. Ronald Schwartz joins us now to discuss these alarming facts, and he has some information about a memory screening that can help with early detection. Good morning.
Good morning.
Becoming more and more prevalent with our baby boomers. Tell us a little bit about what we should all be looking for when it comes to Alzheimer's.
Well, the main features of Alzheimer's obviously is memory problems. So as people age, you're getting forgetful, you're misplacing items, keys, small things that start to bother you and affect your activities. Is it normal aging, or is this something which is more pathological and more important?
Yeah, because, I mean, those are normal things for everyone in a busy lifestyle. But so how do you know then when it perhaps is leading into the Alzheimer's stage?
Well, we've developed something called the memory center. And the first layer of the memory center is to get people diagnosed. So you have to recognize that the problems are not necessarily normal for aging. And we've diagnosed Alzheimer's patients as young as 48 and as old as 93. So it's a wide range of age. If you're old or young, if the problems are affecting your activities, you have to get a diagnosis. And that's where the whole thing starts.
Yeah, how do you screen for Alzheimer's?
Well, some screenings are kind of brief, kind of quick memory checks. And if you can pass a screening, it doesn't mean you don't have Alzheimer's. It just means it's a first pass through to just kind of take a broad stroke and say, well, what's going on with you and your thinking processes?
I mean, obviously, Alzheimer's is prevalent, yet I don't know how much is being made and strides in the way of research. Well,
that's the point that is the main emphasis of all this, is to get people educated to, number one, there are current treatments. Yes, they help. No, they don't help enough. So we do need new treatments, and the pipeline for Alzheimer's is so robust. And the optimism that we're going to have new treatments in the not too distant future, it's just overwhelming. If you go to national conferences and national media, there's a lot of excitement about new treatments, disease-modifying therapies, new cutting-edge diagnostics with amyloid PET scanning, and we can diagnose you in life very specifically that you've got amyloid plaque in your brain, you've got Alzheimer's, and shift gears and say, well, what do you do about it now? Well, I can shift you over into a research section where we'll talk about clinical trials and cutting-edge medicines and all sorts of things, which there's more to do than we have ever had before.
You foresee a cure in our lifetime?
Well, there's a paradigm for getting people diagnosed as early as possible, and then if you can slow that course to the point where it doesn't impact your life, if you haven't cured the initial impetus, then you at least have slowed it down so it hasn't impacted your family and your lifestyle and your function to the extent that it is now.
So important that we talk about those screenings. We have about 30 seconds left. Where are the screenings and when are those going to be held?
Well, we have them scattered around the state. There's one in Petal. We're having one in Columbia.
That's the one we have up on the screen tomorrow?
Yeah, the dates are up there. We schedule them throughout the course of the year. This is National Alzheimer's Month. So we try and increase awareness during the month of November. So we're just doing them now, but we do them all throughout the course of the year.
All righty. And you see the phone number there to call for more information, 601-268-5606. And if you want to find out more about those free memory screenings, if you can't make that one, you can find out from their clinic then about others. Thank you so much for joining us.
Oh, no problem.
Appreciate it.